It's time now for the award-winning #1 local talk show in Northeast Pennsylvania, The Sam Lesante Show. Now here's your host, Sam Lesante.
Well, folks, it's summertime, going into autumn, or whatever time it is. Things that may happen to you, like trauma. Some trauma may happen to you. What happens when you have these trauma things that develop as we did this summer or autumn? Today, we have Alexandra Malenka, who is an RN and has her Bachelor of Science in Nursing. She is the Trauma Program Coordinator for Lehigh Valley Hazleton. And we're going to talk about some of this trauma, which I find very interesting. Alexandra, how are you?
Good, thank you.
This is, every time we have a show, I learn things, and we're so fortunate to have Lehigh Valley today on board with us in the greater Hazleton area and Mountaintop and the different areas. Now, tell me a little bit about yourself.
I'm originally from Orgsburg. I moved to Maryland out of college, and I was there as a nurse in the ER down there for 3 years, and now I moved up to Lehigh Valley, Allentown at Cedar Crest site, and I was an RN in the emergency department. I was a charge nurse. I did a lot of trauma, and I worked in triage a lot, and I took this job at Lehigh Valley Hazleton in June of last year, and I'm the trauma program coordinator, and basically I'm trying to get the trauma program off the ground to make sure that we can care more efficiently and more effectively of all of our trauma population.
When I speak to various people in the medical profession, as I told you before prior to the show, my wife's a registered nurse, and you have to have a passion. You have to have a passion for what you do. So here you are in high school or whatever. When did you decide that you wanted to go into, become a nurse and to go into trauma?
Actually, my mother made me start working as a nurse's aide when I was in high school, and I was kind of thrown into that. And I worked in a community hospital on all different floors, and I decided that I did not enjoy the floor nursing and the routine of it. I wanted the excitement. So I went straight into emergency medicine and haven't left.
That's, first of all, I admire anyone who's a medical profession, but, when you have a trauma or something happens, you really have to be together, know what to do, because there's panic on all different areas,
Correct.
Including the person and the family, etc. Do you train for that?
Absolutely, and that's what we're doing now. We're making sure that we have an organized response, that it isn't chaos, that if it is chaos, it's an organized chaos. And maybe looking from the outside, you wouldn't think that everybody has a job, but everyone knows exactly what their role is, where they're supposed to be, down to where they're supposed to stand.
Yeah, I mean, so you train them, and again, I think it's a talent, but it's really, admirable for people who are in that trauma situation. I've seen that happen a couple times, and I see the calmness and how you work up there. What are some of the main conditions you see in patients?
Well, we see a lot of, our number one thing that we see are falls, specifically elderly falls, older than 65, I would say. Mm-hmm. That's number one, and that's a national statistic. We also see a lot of motor vehicle accidents, and especially being close to, I-80 and 81. That's really another big component to our traumas. And another thing would be a lot of, we also have quite a bit of a burn population.
Is that right?
Mm-hmm. And we also see a lot of gunshot wounds or stabbings. That's another high prevalence in this community.
So what you're doing is you're training these people for these things to happen. My wife was telling me last night that she heard about a person who had a snake bite, mm-hmm. and on the way to the hospital took a coronary and died. Mm-hmm. Okay, is that something that's common or
I'm not sure how many animal bites they actually see every year. Yeah. It depends on, you have to get to a higher level of care. You have to get to those big university teaching hospitals like Lehigh Valley Cedar Crest.
So if someone gets bit by a snake, I mean, mm-hmm. Summertime now, it's warm, and someone mm-hmm. they get bit by a snake, what should they do?
The number one thing they should do is, well, first they need to call 911. Yeah. And 911 more than likely would fly them to the nearest level 1 trauma center
Okay.
to get the appropriate treatment.
Don't they have like things up here that you take a shot or something?
Anti-venom?
Yeah.
I'm not sure if Hazleton does or not.
I think they do.
Do they?
Yeah, remember last year, but it's crazy things, but you know, how many
Yeah.
times, first of all, I don't like snakes.
No.
I don't like them at all.
I'd like to stay away too.
Another common thing that happens here is the ATVs.
Yes.
Okay, so what about those specific traumas?
So ATV accidents, if you were to live in the city, in say Philadelphia, those physicians probably have never even treated anyone that's been on an ATV accident. However, in this community, ATVs are not only used just for sports, but they're also used, for farming and for recreational use, and also just other kind of around the house, everyday uses. And with that being said, we see quite a few ATV accidents. And one of the biggest causes of ATV accidents are rollovers, because people are driving on the road and they're not made for the road at all. The suspension is not built for paved surfaces.
I guess precaution is always important. Sometimes, when you get on a motorcycle or a ATV, you get revved up, excited, like anyone, if you're on a roller coaster ride, etc.
Right.
And sometimes they don't, they're not really being concerned about what's happening. They're just into the excitement of that, I would think, okay, because if a lot of this is foolishness when you roll over, if you have a collision. What do you see mostly? Rollovers?
Yes.
Okay. So what do you think, let's talk about safety on ATVs. What should they be doing? Now listen, all you ATV people.
So the number one thing that you need to remember is that there are specific, a lot of Pennsylvania laws that need to be followed regardless of your age group. And it also, make sure you're wearing a helmet at all times, and make sure it's, a PennDOT approved helmet, and that you go to a proper ATV store and make sure that you're covered in equipment from head to toe at all times, no matter how hot it is outside.
So
Protective gear is the number one thing.
So some people feel that they don't need to wear a helmet. Okay, so let me ask you, of the traumas you've seen on ATV accidents, are there a higher majority of people getting hurt because they don't have protective gear versus those people who just are carefree?
Correct. So it would be everyone that is not helmeted is going to have some type of head injury. And most of those head injuries, because you're riding quickly or riding fast or you're rollover, usually result in a traumatic brain injury, which never has a good outcome. And those patients need to be airlifted to the nearest hospital, to the nearest level 1 trauma center, and be taken care of, and they usually do not have good outcomes. The other thing is patients that have road rash. Those people need road rash, meaning they got scraped up from head to toe. They need, specialized procedures to have washouts in the, in the operating room so they don't get infected. Sometimes they end up at a burn center to be treated for burns because of the road rash. All kinds of broken limbs. I've seen amputations. There's been a lot of ugly stuff.
Yeah, particularly if you're not equipped, if you're not dressed properly, or if you don't have the protective gear, things can happen. A while back, many years ago, there was an accident up here where a person was actually decapitated. Yep. They went through an area which says no trespassing, and they were on an ATV, and you're free, didn't see this rope or wire, and boom, it was such a sad thing. Yeah. And I know the hospital, Lehigh Valley, is great in education. Mm-hmm. They always are informing people, like our shows here, as to what you should do in different areas. ATVs, again, we should be concerned about the proper, because you see it, it's like people who smoke, it's just, tell them not to smoke until something happens. Yep. Another, when I come back from break, I want to talk about the elderly and falls and fractures, okay? That seems to be another situation that happens. And the old adage which says, if you're old and you fall and you break your hip, you're going to die. Okay, folks, I'm talking to Alexandra Malenka. She is the Trauma Program Coordinator at Lehigh Valley Hospital here in Hazleton. 570-501-4000 is the number. We'll be back right after this. Welcome back to the Sam Lesante Show, folks. Today we are talking about trauma risk. Some of the summer, all year long, actually. And we have Alexandra Malenka from the trauma she's a trauma program coordinator. But remember, folks, if you want to watch all of our shows on ssptv.com 24/7, and my email is sam@ssptv.com. And now, Alexandra, you said what you're doing is you're developing or training a trauma program up in the Lehigh Valley Hospital here in Hazleton, correct?
Yes.
And how are you going about doing that?
Well, it is a lot of moving parts. It starts in, the commitment from administration in the hospital, and it filters down to all the departments. Trauma doesn't just touch the emergency department like we'd like to think. It touches all of the departments within the hospital, and it requires everybody to be on board.
Yeah.
So.
And I'm sure you're doing well with it.
We are getting there, yes.
Now, we talked about falls and hip fractures, all right? And again, elderly people, are not as mobile as they'd like to be. Right. And sometimes they fall and they fracture their hips, okay? What about those? I mean, what do you do? What do you suggest, to prevent some of these things, or what happens when they do come in?
So I would have to say that the number one causes of falls in the elderly are, a lot of trips and falls. So preventing your home from having anything to trip over is probably the number one. Make sure that things aren't cluttered, your house isn't cluttered. Make sure that if you need extra help, you ask for it. The throw rugs on the floors, that's, nobody likes to get rid of those because they look so nice.
But that could be very dangerous.
Yep. And even down to in the wintertime when you have kerosene heaters, a lot of older elderly population have kerosene heaters, and just the plugs, the simple plugs, or the plugs to the cords to the fans, anything, you can trip over those, when you're, not paying attention. Another thing is to make sure that you don't get up too quickly, and make sure that, you don't get dizzy if you have any kind of dizziness issues. The older you get, the more your blood pressure tends to drop faster when you stand. Mm-hmm. So that's another issue that you have to be careful of. And I think that's about it.
Well, the thing is taking an inventory of your home.
Right.
For example, sometimes you go to bed, and you get up during the night or whatever, didn't realize that you had a chair or something in the way, and you fall because you're not really having all your faculties when someone gets up in the morning until they get a little bit tuned in.
Right.
And I think if elderly people would look at, not only elderly, but anyone, okay,
correct,
looking at, what do we have in the house that can cause a problem,
right,
okay? And I think there's a lot of precautions come. Now, what is the story about, if when an elderly person, in their 80s or, breaks a hip or falls and snaps a hip or whatever, why is it, they say, well, that's it, they're doomed,
So it's interesting because your elderly population can be divided into your very healthy and active elderly patients. Some of them still drive. My grandmother's 93 and still drives around and play bridge, right? Wow. But the other, elderly population might be more homebound, might have a lot of multiple medical issues. And it tends to be that population when you fall and you injure something, and it might not just be a hip. Rib fractures are also a huge trauma-related injury from falling specifically that can really increase your mortality. And that's because if you have diabetes or hypertension, or if you have a history of blood clots, all those things can play into factor and be exacerbated when you have a prolonged bed rest from, while you're recovering from a hip fracture.
So a person knows their condition, okay? They know whether they have high blood pressure or diabetes or whatever. So therefore, if an elderly person, I would think have some precautions, and maybe a walker,
right,
maybe a cane,
correct,
something to help them so they don't run into that problem and be, because they know they have that, whatever, problem they may have.
Right.
Am I correct in saying that?
Yes.
Okay. So sometimes things happen just like that. So you ever fall on the ice? You ever slip on the ice?
I have.
Guess what? It happens like
You don't
bada
even
bing.
know.
I mean, it's like amazing, I guess in the wintertime you have a lot of those falls, people.
Absolutely.
Yeah. And here again, no matter how cautious you are, you could hit something and slip and fall. Just pray that you don't break anything or whatever. So again, for the elderly, they know if you're in a situation where you're not that healthy, have the precaution of either helping with a walker or something so you don't fall.
Right.
Well, as I'm asking these questions, I'm thinking about Lehigh Valley Hospital, the whole network, how they always educate in any area, cancer, breast, you name it, they're there. Is there any seminars or any times that you have people where you have meetings or get-togethers and talk about different things, the preventions and stuff like that?
I know that the Health and Wellness Center has a big fall program out.
I highly recommend
Yeah,
anyone to do
absolutely.
that because I encourage people to watch the shows, and we have all these health shows on. But there's a lot. I had one lady who saw one of the doctors on. She said, "I didn't know that, Mr. Lesante, but I did this, etc." So it's informative and hopefully help them, particularly ATVs where your helmets. Make sure you do that. All right, let's talk about burns. Okay, what types of burns do you see often in the Lehigh Valley Hospital ER?
We see a lot of hot water, hot liquid burns. We have a population. We have a population of children that pull things down, pull hot chocolate down on them, pull hot water down on them, or so on and so forth. We also see a lot of campfire burns.
Okay.
People might be drinking, have a good time, and trip and fall over campfire and have some kind of thermal burns that are, really can be very serious.
Once again, I think if you're in the home with your child, of course, mothers, like, God bless them, because they have to have 45 eyes and 25 arms, and just to take care of their children. But again, it's a precaution. Just think a little bit when you're in the house, and a lot of these accidents happen because you have so much going. And once again, if you slow down a little bit, it's easier said than done, particularly when you have 3 or 4 kids running around. Then they bring their friends over from the neighbors, and you got 35 kids, and you want to pull your hair out and scream. Again, precaution. One of the things also in the summertime, I found, I don't know if you had an experience, but they have the hoses. And so they'll go in and have lunch, and it's like 90 degrees outside, and then they get the hose and squirt it right on the person. Well, that water is hot in the hose,
Right.
and they get burnt pretty good. So just be careful if you're outside, etc. I should come and join you. I should come up and with the trauma. Hey, I'm getting a degree here. Here's another one, and hopefully this is, people are becoming educated. Fireworks. You see a lot of those?
We do see fireworks are big for hand injuries. There was quite a few deaths around the nation from fireworks, from people being, not cautious enough or not paying attention when they explode. So fireworks can be, multifaceted. It could be just the sparklers and you get a little burn here and there that needs to still be treated, or, it can be a whole, the explosion part of it as well.
How crazy are some people?
They can be pretty.
I mean, here's a guy, you probably heard about the guy who set off fireworks on his head. I mean, first time it failed, and they're saying, "Are you crazy?" He puts a firework on his head and blows his head apart.
Yep.
I mean, how nuts can you be? It's just crazy, I know we used to have the sparklers and little fireworks from, when my children were young, and we had. But sometimes, if you want to see fireworks, go and see a display.
Correct.
Without doing that. So again, it's being cautious, correct?
Right, and it's really not using it at home.
Now, okay, what's the teleburn program?
The teleburn program is a program between Lehigh Valley Health Network Cedar Crest and Lehigh Valley Hospital Hazleton. And what happens is they have an actual a camera that they use specifically for burns. They can upload the images at Hazleton and send them down for the burn surgeons to view to decide whether or not that patient needs to be transferred or not.
You know, I'm going to tell you something. That is one of the greatest things about being affiliated with Lehigh Valley.
It's amazing.
I mean, not only that, but other doctors who can just go to computers and they have access to all these great doctors, and our doctors are fabulous to begin with.
Correct.
But here you go. It could save a lot of people's lives from that. And I was at that burn unit in Lehigh Valley. We did a show, about 4 or 5 years ago down there. Folks, I'm talking to Alexandra Malenka, who is a trauma program coordinator at Lehigh Valley Hospital here in Hazleton. 570-501-4000. When we come back, we'll talk a little bit more about this, the trauma program. Stay with us. Welcome back to the Sam Lesante Show, folks. We're talking about trauma risk, summer, autumn, winter, you name it. And we have the trauma program coordinator, Alexandra Malenka from Lehigh Valley Hospital here in Hazleton. And a lot of preventions, as you said, could prevent a lot of things. But the trauma, another concern, how about bicycle safety?
Bicycle safety is big.
Is it
you know,
really?
you can go out on the street, and especially here around town, and you see kids and adults all alike without helmets on. And I can't even stress to you enough the importance of wearing a helmet at all times. And, you know, adults and parents should be setting examples for their children, you know, by, you know, A, making them wear a helmet, and B, wearing a helmet yourself.
You know, one thing that a lot of older people, including me, habits. You know, if you get into a habit of doing things like it's right, like an airplane pilot, he has to check everything. He has a checklist. It has to be done. But if you get in habits, older people are very seldom, maybe in their 50s or 60s, don't wear seatbelts as much as they should because they never wore them before. But younger people, it's just, it's automatic. So habits of knowing if I'm getting on the bicycle, make sure I have my helmet. If I'm ATV, you know, make sure I have the appropriate thing. So how important, this is a stupid question, but I'm going to ask it to you. How important is prevention?
Prevention, let me put it like this, and this is what I say. Trauma will always happen. It's part of life. There's always going to be car accidents, and there's always going to be falls, and there's always going to be, you know, other issues. But you can prevent. The most you can prevent, the better. So prevention is the number one. It will never take away trauma, but it is the number one thing involving trauma.
You know, it's interesting. My father told me when I was getting my license, and he said to me, he says, if you're going to have an accident and you know you're going to have the accident, what do you do?
Right.
Well, I said, you know you're going to have the accident. What do you do? I said, I don't know, Dad. He says, you look for the least amount of damage that you can happen. So like you said, something may happen, but if you have a helmet on, if you have something on, it can certainly help, you know, to prevent some serious injuries, okay? Here again, something happens, trauma happens, you know, now panic sets in, particularly if your kid, something happens. What do you do? What do you tell people if someone is seriously hurt, okay, and they have to go, you know, they're on their way to the hospital? What do you tell these people?
So almost all the ERs, you know, in our ER is equipped with, we have a patient care advocate who is there for the families when they arrive. He makes contact with the families, and he makes sure that they are aware of their, you know, loved ones, not necessarily condition, but that they are at the hospital. Now, when you get those phone calls, like you said, you want to panic, but the number one thing that you need to do is try to find yourself a ride. Okay, and make sure that when you come to the hospital, that on your way you stay calm. If you have to drive, take a minute, breathe, and get in your car, and don't drive like a maniac to the hospital because you're going to end up, you know, a trauma yourself.
And that's always the case. I mean, you know, but that's easier said than done. We both know that.
Absolutely.
But if you put that mindset in there, it's important. Well, I'll tell you, Alexandra, like I said, Tammy brings all these great people to me, and I learn a lot, okay? I wish you the best, and you're doing a great job up there at Lehigh Valley Hospital Hazleton. Alexandra Malenka, folks, we're talking about trauma risk. Once again, prevention is the best. And folks, once again, be compassionate to all those people who are in the medical field today. They really work hard. The nurses, the aides, the receptionists, everyone who's involved in medical care today. They need your compassion because it's not an easy task. If you've been in a hospital and you've seen these nurses work and the aides, they really work hard. So a little smile once in a while, a little thank you goes a long way. Remember, any information you want about Lehigh Valley Hazleton Hospital in Hazleton, you can always go to their website, go to ours, ssptv.com, 24/7. We'll see you next time.